My dear and esteemed colleague, the case you bring to our attention is of truly exceptional and significant interest. Have you had the chance to observe the specific details in the fetus on the left? The bladder, you can see it even now. Now, please take a look at the other fetus. You will notice that you cannot see the bladder. So it is a monochorionic, diamniotic twin pregnancy. Observe, this is the fetus with the renal pathology. You will see a perfectly normal appearing heart, but what you really need to pay close attention to is what you see right now. You will notice that directly attached to the body of this fetus, the membrane. This is to tell you that this condition can closely mimic the appearance of, but it is actually not truly, what is known as a monochorionic and monoamniotic pregnancy. But within just a few more seconds of observation, you will clearly see that the affected fetus has the umbilical cord pressed directly up against it. Watch. This is the moment. This is the moment when you see that this one is attached. And you can see the thin membrane that separates them. What is the importance of this case? It is related to the fact that since this is a twin pregnancy, monochorionic and diamniotic, you know there is a double risk of an anomaly affecting only one fetus. And it is not necessarily the case that the anomalies are the same. In fact, in the two fetuses, the other one is perfectly healthy. So what do you need to look for? You need to look for, I'll say it again, the thin membrane that separates them. You need to see that it is pressed up against this fetus. You need to see that in this fetus, you cannot see the bladder. You will never see it. You won't see the kidneys. You'll see everything else is normal, but I won't show you that because it's not very relevant, except that in these cases, you have to explain to the patient that there is a fetus that it has a medical pathology that is completely incompatible with sustaining life outside the womb. You can see the amniotic membranes tightly pressed up against this fetus on the right, and you really need to tell her that she must travel to the center. To evaluate and determine what the clinical management plan of this pregnancy should be. Management that is not easy to determine, but that will be decided. Who is responsible? But this is what you need to see. You need to see that you do not see in the longitudinal sections adjacent to the spine. You don't see the kidneys, and you never will. And this is the affected fetus. That tiny anatomical structure you see is the adrenal gland, located right here. And of course, this fetus, also because of its complex physiological relationship with the other one, which is adjacent, has a normal amount of amniotic fluid and also a little movement. Take a close look at this image. What exactly do you observe here? You are unable to see any signs of the kidneys, and you don't see the bladder either. You can clearly see the male genitals. You can identify the developing limbs, and again, you see the very thin and delicate small membrane that separates him. Now, what should you do in these cases? You need to be sure, so you have to look at it many times. And you should also use color Doppler, as you're doing now, to carefully determine if there might be any pelvic kidneys that could completely alter the entire clinical diagnosis. You need to perform the examination procedure several times and observe the area several times. Here, you see the fetal extremities, which you saw for a brief moment. The thin amniotic membrane that separates the two fetuses. Naturally and understandably, one is led to believe that the other fetus has the exact same condition. No, the other fetus is perfect. You have to keep checking many times, even in the transverse sections, in case you see the kidney, if you see it in the pelvis, but it's not there. If the bladder disappears, it doesn't appear. And so, I repeat, at this point you move on to study the other fetus, which must be observed with extreme care, which will turn out to be normal. For the umpteenth time, I'm showing you the spine and the absence of the kidneys. It's a diagnosis that demands an extensive amount of attention, and of course, as I told you, meticulous and thorough management is needed to comprehensively explain all the critical issues to the patient, which are directly associated with this situation. Now we are carefully observing this view, and now we are moving on to look at the other fetus, which is looking absolutely perfect. I would just take a moment to show you a few things. Right here, I am showing you exactly what we can see. The head here, you can see the profile, which is normal. And now, instead, we'll pay close attention to the urinary system, where the main sign is represented by the presence of the bladder. The presence of the bladder indicates that at least one kidney is functioning. Then, a bit later on, we will clearly see that both of the kidneys are present, so we can finally conclude our discussion on this matter. Here you see the abdomen, the gallbladder. Now we'll move down and take a look. Here is the bladder. You see the bladder. So this means that this fetus, thankfully, at least one perfect kidney, it has it, but we'll go check. Here you still see the other fetus. Here you don't see the bladder, you see. Okay, I showed you here. To show you this, here you see the amount of amniotic fluid, which is normal, and here we see again the, in quotes, healthy fetus. And here it is, this one. Here you need to pay close attention. Here you have the spine and you have the two kidneys, one above and another below, both perfectly normal with the small pelvis. Here they are, 1 and 2. So this second developing fetus has a completely normal urinary system. So they are currently in the process of finishing up the very last images. I repeat, what you specifically need to do is provide comprehensive counseling. You need to refer her directly to the medical center specialized in monochorionic pregnancies. It is absolutely essential that they explain all the critical issues to the patient in detail. Thank you very much for your kind attention, and I sincerely invite you to carefully read through this entire case to fully understand all the critical aspects present in these complex situations. Furthermore, we must consider what is the best possible solution and the most effective management strategy. Thank you. Thank you once again for your time and your attention.